All right, let's jump right in. We're talking about tocilizumab today. Now, this is a really powerful drug for a bunch of autoimmune conditions. But, with any tool that powerful, there are always risks. It's really a classic double-edged sword, and that's exactly what we're going to unpack. So, what's the magic here? How does it actually work? Well, imagine your body's inflammation response is like a chain of command, with signals getting passed down the line. Tocilizumab is super clever. It steps in and basically cuts the wire on one of the main messengers, this molecule called interleukin-6, or IL-6 for short. By blocking the receptor where IL-6 would normally plug in, it stops that go-go-go inflammation signal right in its tracks. It's a really precise way to, just dial down the heat when the immune system's going a bit haywire.
And because it's so targeted, it's used for all sorts of things. Different kinds of arthritis, even a really serious condition called cytokine release syndrome. But for our purposes today, we're going to zoom in on one of its most powerful uses and, of course, the big trade-offs that come along for the ride.
Okay, so let's start with the good side of the sword, the really remarkable benefit. We're going to look at what it does in a disease called systemic sclerosis. And what it does here is, well, it's a huge deal. It helps protect the lungs.
So, where do we get this info? It comes from a big clinical trial, cleverly named the FOCUS-FEED trial. Now, this study didn't just look at anyone. It focused on a group of patients who are in a really tough spot. They have an early, aggressive form of the disease and are at super high risk for permanent lung damage. And that's key, right? Because once that kind of scarring happens, there's no turning back.
And just look at this data. This is where it gets really, really striking. We're looking at something called forced vital capacity. It's basically a measure of how well your lungs are working. Now check this out. Over 48 weeks, the folks on a placebo, their lung function dropped by more than 6%. That's a significant decline. But the patients taking tocilizumab, look at that number, a change of negative 0.1%. It's basically nothing. Their lung function was almost perfectly preserved. I mean, that's not just a small difference, that is a huge deal.
And the conclusion from the study itself just hammers this home. The researchers said flat out that tocilizumab stabilized lung function. But here's the kicker. It worked no matter how much lung disease or fibrosis a patient already had. Think about that. It suggests this incredibly powerful protective effect, even for people who are already struggling. That's a game changer.
So that's an absolutely incredible benefit. For sure. But you knew there had to be a but, right? This brings us to the other side of the story. What is the price you pay for this kind of power? What are the trade-offs?
And that brings us to the sharp, dangerous edge of the sword. We're talking about the liver. This is the main counter-argument, the big warning label that comes with all those benefits. So, what does this risk actually look like in practice? Well, for a lot of people, maybe up to half, there's a mild bump in their liver enzymes. It's often temporary, nothing you'd even feel. But, and this is a big but, for a small group, around 2%, those numbers can go way, way up, more than 5 times the normal limit. And that, well, that's a clear red flag that the liver is not happy.
And we have a formal risk rating on this from the Liver Tox database, which is a super reliable source. They call it a probable rare cause of clinically apparent liver injury. Let's break that down. Rare means it doesn't happen to most people. But probable means when it does happen, the evidence strongly suggests the drug is the culprit. So the risk is small, but it's very, very real. So because this risk exists, you don't just get a prescription and get sent on your way. Not at all. There are really strict safety rules. Doctors have to check your liver before you even start. Then they check it every 4 to 8 weeks for the first 6 months, and then every few months after that. And the rule is simple. If any severe liver injury pops up, that's it. The drug is stopped permanently.
Okay, let's shift gears to a really important, practical question that comes up for a lot of patients. What about new moms? How does this whole risk-benefit thing work if you're breastfeeding? Is it safe?
And you might be surprised, but the answer here is actually pretty clear and reassuring. The experts at the NIH's LactMed database, this is their whole thing, say that international guidelines pretty much agree. The drug is considered low risk to the baby and it's okay to use while breastfeeding. That's a huge weight off the shoulders for many people.
So you're probably wondering, why is it considered low risk here? Well, it's pretty cool science. First off, almost none of the drug even makes it into the breast milk. What little bit does is a big, clunky molecule. So it gets into the baby's stomach and is likely just broken down by digestion, meaning it's probably not absorbed. And the real-world evidence backs this up. We've got multiple case studies showing no problems in nursing infants.
All right, so there we have it. We've seen both sides of the coin. The incredible lung-protecting power on one side and the serious risk to the liver on the other. So let's pull this all together and look at that final, crucial balance.
And this slide really sums it all up, doesn't it? On one hand, you have the promise, stopping lung function from declining in patients who are really in danger. On the other hand, you have the peril, a clear risk of liver injury, anything from a mild common blip to a rare but very severe event. This is the tightrope that doctors and patients have to walk. It's all about weighing which of those outcomes is the bigger threat for that one specific person.
And that leaves us with the big final question, a question that really gets to the core of what personalized medicine is all about. For any one person with their own health history, their own life, their own level of disease, how do you make that call? How do you strike that perfect balance? It's just a powerful reminder that in medicine, all the studies and stats in the world don't matter as much as the individual sitting right there in the room.